The following presentation is on ethical considerations for human papillomavirus, HPV, and the healthcare professionals' associated roles. This topic is presented by Jennifer Friesen, Tony Ann Cope, and Robin Edwards.
Hello, my name is Tony Ann Cope, and I will be presenting on the objectives for this presentation on ethical issues related to the HPV vaccine. At the end of this presentation, the reader will be able to 1. Define human papillomavirus or HPV, 2. Identify the prevalence of HPV, 3. Identify the vaccine for HPV and the dose schedules, 4. Discuss some ethical considerations related to HPV vaccination, and 5. Identify the role of the healthcare provider when ethical issues arise. Human papillomavirus is a group of viruses that can cause warts on various parts of the body. This virus can be spread through direct sexual contact with someone who has the virus or through other intimate skin-to-skin contact. Some of the risk factors that are involved in contracting this virus include lifetime multiple sex partners, history of infection with other sexually transmitted infections, early age at first intercourse, weakened immune system, and the presence of viruses such as HIV. There are two types of HPV, those that are low risk and those that are high risk. Low risk HPVs are those that are less likely to cause a disease, while high risk HPVs are those that are more than likely to cause cancer. In terms of the prevalence, almost all sexually active men and women get HPV at some point in their lives. In 2018, HPV, amongst other STIs, accounted for 98% of all prevalent STIs and 93% of all new STIs. I will now speak on the vaccination schedule for HPV or human papillomavirus. Children as young as age 9 can receive the vaccine, but it is recommended that children between the ages of 11 and 12 receive 2 doses of the HPV vaccine, each being administered 6 months apart. If the HPV vaccine is administered to children on or after age 15, then 3 doses are recommended, each being 6 months apart as well. If older than age 26, then it is not recommended that this vaccine be administered, as those young adults would have already been exposed to the virus and the vaccine would be less beneficial.
As with any vaccine, an ethical consideration is whether the vaccine should be required or recommended and to whom. The human papillomavirus and its vaccine have characteristics that push gender to the forefront of this discussion. For example, HPV was attributed to an estimated 21,700 cancers per year for females compared to 15,600 for males. Females may suffer a significant majority of the HPV diseases worldwide, which includes other problems caused by the virus besides cancer alone. Vaccination of females against HPV has been demonstrated to improve gender equity due to reduced burden of illness, increased opportunity, and improved socioeconomic status. Cervical cancer, a major cause of female death worldwide, is almost always caused by HPV, making protection from HPV by females a health imperative. Oropharyngeal cancer causes more deaths than cervical cancer. And the number of males who develop oropharyngeal cancer as a result of HPV is actually greater than the number of females who develop oropharyngeal cancer and has even surpassed cervical cancer. This demonstrates that both genders significantly benefit from the vaccine. However, the rate at which males are vaccinated is far greater than that for females. This inequity suggests that the public and healthcare community have not adequately prioritized male vaccination. Possible barriers to appropriate prioritization likely include the fact that the initial approval and associated rollout actions for the vaccine were directed at female vaccination, or by a lack of knowledge of all the types of cancers that HPV can cause, or because of the reluctance of adoption of male vaccination processes and practices, or because early literature regarding the vaccine questioned whether males should be vaccinated, whether it was fiscally responsible, and the suggestion that males might be vaccinated in the interest of social equity rather than focusing on their personal health benefits. It was initially suggested by some that male vaccination would be unlikely to be cost effective. Finally, it is possible that perceptions of responsibility for reproductive health falls to females, as has been seen with contraception. Responsibilities of healthcare providers includes maintaining awareness of risks and benefits as new information becomes available, and being appraised of disparities between public understanding and reality so that misconceptions can be identified and addressed. Build trust and have the resources to correct misunderstandings. And consider timing and approach when offering the vaccine. For example, offering it with other vaccines like the flu vaccine. Continuing with population considerations, there are ethical concerns that apply specifically to children. Vaccine safety considerations such as injury tracking and recording or compensation following vaccine injury fall under the National Childhood Vaccine Injury Act of 1986. All HPV vaccines were added to the National Vaccine Injury Compensation Program in 2007. So, in the event of a vaccine related injury, compensation should be managed just as with other vaccines. That said, the incidence is extremely low and considered to be far less than the risks associated with not receiving the vaccine. Consent for procedures performed on children is generally given by parents. However, there is no federal requirement for consent prior to vaccine administration. Policies for informing and or obtaining consent prior to vaccination of a child will vary from one state or facility to another. In accordance with the National Childhood Vaccine Injury Act of 1986, HPV vaccines have vaccine information statements, which must be provided to the legally consentable individual. This vaccine is given to prevent an illness that is primarily caused by sexually transmitted disease. Yet, the guidelines for administration extend into ages young enough that many families may consider the child too young. This may push families to engage in sex education discussions before they are ready, or it may result in parents making a decision without appropriately including the child. This is an ethical conflict because the pediatric patient may be expected to behave as a child while being treated as an adult, or vice versa. This conflict can infringe on a child's rights of sexual self-determination at a time that the child should be developing a sense of self that is independent from their parents. It restricts their autonomy and their empowerment. The health practitioner's role is to advise families of the need for vaccination at the same time as other adolescent vaccines. Also, to be watchful for indications of earlier sexual activity so that sexually active children can be captured before exposure. They must be aware of state and local policies regarding consent related to age and reproductive health so that they can serve as a resource if conflict arises. They must, of course, provide the legally required vaccine information statements. As with any pediatric consideration, providers should foster honest discussion and shared decision-making in families, and should build trust and be prepared for respectful conversation when hesitancy presents.
According to the CDC, current guidelines don't recommend HPV vaccines for pregnant women. HPV is unlikely to cause complications during pregnancy. There is no identified link between HPV and adverse pregnancy outcome, such as preterm delivery, transmission, or intrauterine fetal demise. The major concern during pregnancy is the route of birth. If significant lesions are present, a cesarean will be recommended to eliminate excessive bleeding. If a female has an active infection during pregnancy, warts can grow larger than they normally would. Pregnant females who have HPV should get routine cervical screening exams during pregnancy, since they have a chance of developing genital warts or developing abnormal cell changes on the cervix. There is no cure for genital warts, but there are medications available to treat them. Treatment for pregnant women include topical medications to treat the warts, making them less visible, but may be limited during pregnancy as it has not been approved by the FDA. HPV is the most common sexually transmitted disease noted in the United States and is most associated with cervical cancer. Approximately 14 million new HPV infections occur each year, according to the CDC, and estimates that 80 to 90% of sexually active men and women will be infected with at least one type of HPV. Many people with HPV don't develop symptoms but can still infect others through sexual contact, therefore making tracing difficult. Most people with HPV don't know they are infected and never develop signs, symptoms, or health problems. Men usually discover they have HPV once they develop genital warts, while women find out once they get an abnormal Pap test result found during a cervical cancer screening, while others may develop a more serious problem such as cervical cancer. HIPAA privacy rules protect the patient's right to privacy, yet balance the need for disclosure and protection, particularly in situations when the information is required for patient care.
In summary, the HPV vaccine is only effective if given before sexual activity and exposure and protects males and females from various cancers. It is the role of the healthcare providers to offer the vaccine and educate our populations. Not all of the ethical considerations related to HPV can be covered in a short presentation, but many roles related to ethical providership remain consistent. One must be aware of common misunderstandings and ready to engage in uncomfortable conversations. One must look outside of their personal experience to develop awareness of unethical or inequitable practices, as well as for implicit bias. Finally, a health practitioner must remain professional, respectful, and worthy of the trust that patients put in them, so that we are able to address and resolve ethical dilemmas as they present themselves. These are the references used in the presentation. Thank you for your time and have a lovely day.